welcome to the show.
Thank you. I'm excited to be here.
I'm so happy to have you, Sophie Lanter. You are the CEO and founder of Soluna Aesthetics and a doctor of nurse practitioner and someone that I admire very much in every aspect.
Thank
And
you.
I'm so happy to have you here.
Yeah, I'm happy to be here. This is great.
Yeah, it's very, very exciting. So you came to working in aesthetics for your own appreciation and like devotion almost towards wellness. Where do you think that came from in your life, and how has it developed over time?
So I grew up as a dancer and a figure skater first, then dancer. And I think that in that type of athletics, it's an art form. So I've always been into this really intense type of physical art. And as I got older, I just had this appreciation for the body, and sports were really the only thing I was good at for a really long time. And then as I began to develop and college came around, I honestly really didn't want to go to college. I wanted to become a professional athlete, and my dad said, no, you're going to college. This is not an option. I then went to college, really didn't know what I wanted to do, and kind of like floundered. It took me 6 years to graduate. Then when I finally figured out what I wanted to do, ended up going to nursing school. I found aesthetics because I wanted to combine medicine, which I loved. My dad's a physician, so I kind of grew up around doctors. I have a whole family of surgeons. So I grew up in sort of this like medical family where it was always talked about and it was always a thing, and I was really fascinated by it. And that sort of transformed over the years to, okay, how can I practice medicine but in a way that's not depressing? And also combine my love of like art and beauty, and aesthetics was just that natural bridge to all of those things. So as I went into nursing school and then did my master's and my doctorate, aesthetics was always my goal from day one. And to be honest, everyone in nursing school thought I was crazy. I went into nursing school telling people I was going to start my own practice and that I wanted to do this thing. And that's not like a conventional thing. When you go into nursing school, they think, oh, you're going to work in a hospital. Oh, you're going to work in a private practice, do primary care, because that's what nurse practitioners are trained to do. But I was like, nope, not me. I'm going into aesthetics. So it kind of became this bridge from my personal love of art and physicality and sports and dance and all of these things to kind of combining that with medicine.
Yeah.
And that's how I came to this.
And just kind of touching upon what we were talking about earlier, in those moments when you were in nursing school and people thought that you were crazy for wanting to go into aesthetics in a context where that was not the norm, how do you handle those sorts of reactions from people when you are so intent on doing what you want to do, but it might go against the grain?
To be honest, I just like kind of laughed at them. I was like, well, this is what I'm going to do, and it's okay if you don't like it. So I've always kind of been that hard-headed, I'm going to do it even if you don't think it's going to work. And I just kind of went for it, and nothing anyone could say was stopping me.
That's so amazing, because I feel like that's a very hard thing to come up against. Like, that's friction for sure.
Yeah, there was a lot of friction. Teachers were not nice to me about it because nurses, like I said, traditionally were trained to work in the hospital. And when I was in the hospital, I really hated it. And for lack of better words, it's dirty. Nurses get abused. It's not a great work environment. Working 12-hour shifts in this confined space where there's literally no fresh air and everyone's just sick, like that's not my cup of tea.
Yeah.
So, God bless the people that do it, but it was never for me, and I knew that from day one. So I got my experience where I needed to, and I moved on to what I wanted to do. So, yeah.
Amazing. And so in your opinion, like when we talk about wellness and aesthetics, in a woman's life or how she thinks about herself, what is the bridge between wellness and aesthetics?
So I think that that's a complicated question because when we think about wellness, typically we're thinking about maybe our labs or, our fitness or our hydration levels. We're not necessarily thinking about what we look like. But I think aesthetics is one of those things that once you understand how it intertwines into your life, it actually plays a huge role in wellness because it bridges the gap of this mental health gap.
Yeah.
And the way that you look really influences how you perform in daily life. So when you're happy with how you look and you look in the mirror and you feel confident, that trickles into your work, your relationships, the way that you work out, pretty much everything, how you think about yourself, how you talk to yourself, how you talk to other people. It's one of these things where it influences every aspect of your life almost unknowingly.
Yeah.
So I think that when people come to me and they are just unhappy, and then I can make them feel happier about themselves by making little tweaks or little adjustments or helping them with their skin or volume loss, that it changes their entire wellness world.
Yeah. I think there's also kind of something to it about hiding from yourself when you don't like how you look, and then hiding yourself from the world as you move through, like maybe hunch shoulders, or you don't want attention, or you don't want to be seen in a certain way. And then when you feel good about yourself, you want to be seen, you want to participate, you want to be out there in a way that is participatory.
Right. And your opinion becomes something that you feel you can share.
Yeah.
And it's almost like you can contribute to the world more, and society more, and whatever you're doing, it's just you become like this more robust person.
Yeah. I think for me, there was a big tipping point when I first started teaching. I remember I was being coached and they told me, like, your shoulders are hunched over. Stand tall. Like, you are leading. You are holding space. You are influencing the energy of everyone in there. And I was like, oh.
Yeah.
Yeah. And I was already too far to turn back at that point. But it was a cliff that was very hard for me to jump off of. So I completely understand what you're saying. And I personally think that for women, how we look is so tied into truly how well we consider ourselves to be. And whether that's shallow or vain, I frankly don't care. But I think it does play a big role in how a woman moves through the world.
Yeah, I agree. And I don't personally think that that's a shallow thing. I think that it's actually like a really deep-rooted thing. And I think that the idea of it being shallow is actually like a shallow, uneducated thought. So, no, not shallow. It's a great thought.
So what does your own relationship to your appearance look like? And how has that evolved over time?
So I think that when I was younger, I was very secure with how I looked. And I was this like confident little girl who was like a great athlete. And then as I got older and moved into teenage years and you get a little bit awkward, I started to not like my weight because other girls were skinnier. And I was not like a big girl by any means. I wasn't overweight. I just was more muscular than most of the girls in my class because of how intense I was with the athletics. So like my legs were bigger and I had more muscle. And to me, that was like bulky and I didn't like it.
Yeah.
So I, for a long time, struggled with that. And then as I got older, I started to like myself again. And once I got out of that like awkward phase, and then I got towards my mid-20s where we start assessing, and I moved to Florida from New York. So everything is a little bit more under a microscope here in New York. Everything's a little bit more natural. I still have friends that don't do Botox in their 30s, where here everyone's starting it in their 20s. So when I moved here, my mindset shifted a little bit, and I started hyper-analyzing myself a little bit more. And I wanted to get my boobs done and get my lips done and get Botox and have perfect glass skin. And that started to kind of like affect my mental health because I was looking at these girls on Instagram that live down here that were like fitness influencing was like a huge thing. That was like the first influencers. I feel like we're like those muscly, tiny fitness influencers back in whenever, 2010, 2014. So I would look at these girls and I'd be like, they have a six-pack. I need a six-pack. Like they have great skin. I need great skin. But like a lot of it was filters and supplements and whatever it was. But yeah, so that kind of as I got older became a factor. And then I got into the aesthetics world myself. I started getting injectables and I realized how transactional that was, like that world. It wasn't a world that I really liked, but I thought that it would fix the problems that I had. So I think that as that relates to my relationship with myself now, as I've gotten older and developed and realized that I want to be the best version of me, not look like everyone else and compare myself to everyone else, which I think that comes with age. My relationship has gotten a lot better.
Yeah.
But I think as you grow, it's always going to ebb and flow, especially through your like teens and your 20s. And for me, it's now in my 30s become this like beautiful thing where I don't hyperanalyze every single little thing, and I'm kind of embracing aging and also embracing whatever aesthetic treatments I need to do to kind of slow that aging process and age gracefully. And I have no shame in talking about every single thing that I do. So I will talk about it all day long.
Well, I'd love for you to tell us.
Yeah.
But also, I would love to hear more about Soluna as a practice,
Yeah.
what you do for your patients, and how that viewpoint on your own appearance kind of translates into the practice.
Yeah. So Soluna has kind of came from all of what I just talked about. It came from this transactional experience that I had and wanting to make it better and wanting to be the patient in the chair that was heard and educated. And I, as someone who was interested in science, always wanted to know more and more and more. So that became this concept for my business. And Soluna, technically it would be like Sol y Luna in Spanish, but I thought Soluna sounded prettier. But Soluna is sun and moon. So it was created based on the concept of balance and kind of this ever-changing balance, because as we age, we're almost like fighting this biological clock, but we're always going to be changing and growing. And just because you're aging, it doesn't make you less beautiful. It just means we have to start accepting those changes and do what we can to, like I said, age gracefully. Yeah. So as I've developed the business, I've definitely developed as a person. I think owning a business kind of shows you who you are and exposes, there's like quotes that say like it exposes like every dark part of you, and it's so true. So I think that in treating my patients, I've actually gained like a lot more acceptance for myself as well. And showing your patients the beautiful parts of them that they might not see, or highlighting their beautiful features. Usually when I sit someone in a chair, I ask them what they like about themselves, not what they don't like first, because I want them to start on a positive note. So,
I love that.
Yeah.
And so what kinds of treatments are you giving to patients at Soluna? Like, what are the offerings?
So I do all types of injectables. I do biostimulators, Sculptra, PRP, PRF. Those are going to help with collagen production and just with healthy skin, thickening up the skin, brightness. I also do fillers, hyaluronic acid fillers, and Botox, volume loss, and wrinkle prevention. Lots of skin treatments, so microneedling, CO2 laser, chemical peels like the VI peel. We do facials, dermaplaning, everything in between. Yeah.
That's amazing. I mean,
Thank
obviously,
you.
I go to you, so
Yeah.
I would trust you with my life.
Thank
so.
you. And you look amazing.
I mean, I'm happy to sit in your chair for as long as it takes.
Thank
and
you.
You know that. The perspective of someone who owns a clinic, like what are the frustrations and the complaints that people are tending to come to you with that you're addressing?
So I think that a lot of women come and they don't like their wrinkles. They don't like their nasolabial folds. That is a huge complaint. And they don't like their marionette lines. And I think that there are a lot of misconceptions around this. So a lot of people come in and they just want their Botox and they think it's going to fix all of their problems, and it really won't. So educating my patients on the actual aging process and what happens to our tissues and our bones, our fat pads on a layer by layer basis is something that's helped me be successful and help patients become less frustrated about the aging process. Because when they understand what's actually happening and why we need to do multiple different modalities to treat what's actually happening, they can understand, they can process, we can make a plan, and then move forward.
That's amazing. And so what is that process? Like, how does that work over time?
So it's starting from bottom up. We have bony reabsorption, so we start to lose bone. We also start to lose our fat pads. They start to kind of shrink up. We have a couple of fat pads that actually hypertrophy. So 3 are infraorbital, our nasolabial folds, and our jowl fat pads get like bigger and kind of come down. Mm-hmm. We have attenuation of our ligaments, so they kind of get leathery and they're not really flexible, whereas before it allowed for kind of more movement in the face.
Yeah.
And then we have the muscles kind of get bigger and heavier, and the skin begins to atrophy. So we lose collagen and elastin and that pretty bounce. As we age, it's degraded, so it starts to break down. So when we are looking at the face from a holistic angle, we're looking at bottom up, what's actually going on? Where is this person at? Are they on weight loss drugs? Have they just lost a lot of weight just in general? Because that can affect, the bone, and that can affect the fat pads in the face. We're looking at how we can restore from bottom up in the best way to just make them look like themselves and give them back kind of what they've lost over time.
Mm-hmm.
Yeah.
Yeah. And true. You are very true to that, because I've sat in your office and come to you thinking I need one thing.
Mm-hmm.
And you do explain it, why it's not just one thing. And I love when you use the word like airbrush or sprinkle, because you look, like you said, you look at everything as a whole, and you are incredibly discerning and very, very considerate of like the smallest detail in the best way.
Thank you.
Yeah.
I appreciate that.
No, it shines through. I mean, I think that also goes towards so much of like what is important in an approach to your own health, or how you select an injector if you're going for those aesthetic treatments. What are some mistakes that you see people making in the selection of those treatments, or how they've kind of moved through the world in response to them coming to you?
So I think that like I said, a lot of these med spas are transactional, and they're going for volume. So injectors see 20, 30 patients a day, and I props to them, but I could never do that. So I think that, in my opinion, a mistake that is made is going to someone who either doesn't look the way that you want to look, and maybe looks overdone, and maybe they love that look. But again, if that's not the way you want to look, don't go to them, because that's how they perceive beauty.
Yeah.
And like we talked about, I just did a whole thing on my Instagram about this. If you want natural injectables, you should go to someone that looks natural, and you should go to someone that you think is beautiful. So, it's really important when you're selecting someone that you are going to someone that has the time and is willing to take the time to explain these things to you, willing to take the time to spend on your actual treatments, and they're not just going to go 1, 2, 3, here's your Botox, get out, because they have to meet a quota. So again, no shade to those people that are doing that. It's just not how I run my practice.
Yeah.
And we cap my practice 15 patients a day. Sometimes I see 4 patients, sometimes I see 8 patients. It really depends on what procedures are scheduled for that day. If I'm doing Botox and, some microneedling, we're going to see more patients. If we're doing more procedural medicine, we're going to be seeing less patients that day, because I like to spend 45 minutes to an hour on the injectables and make sure everything's perfect, and make sure that we're refining and, really digging into those little details. So I think people don't understand that, and there's not really any education about it. People don't talk about it. They're just like, come in for your lips, $5.99. And they see that on Instagram, and they're like, all right, I'm going to get my lips done.
Yeah.
But maybe they really need to balance their face, lips, chin, and a little bit of cheek. Or maybe they need to dissolve their old lips and get their lips redone because their lips are migrated, or they're just, there's some old filler that just doesn't look good.
Yeah.
So I think that also allowing the patient to dictate their treatment, obviously you want to hear their concerns, but the provider should never let the patient dictate the treatment.
Yeah.
So, and I think that that's also a hard thing for providers, because you want to make your patients happy, and you don't want the patient to say, oh, I'm going somewhere else, because med spas are a dime a dozen. So it's really about finding your person, and finding the person that's going to listen to you and take the time with you.
And what would you say to a listener who is in that search phase to find their person, and who may not have access to you, like may not live in this area? What does that feel like to find the right person for you in terms of injectables or aesthetics?
I think that sometimes it takes trial and error, but I think that maybe go for a consultation before you jump into an actual treatment and see how much time they take with you and see if they're pushy about their treatments and see if they explain, if they educate you and explain, let's say you go in for your nasolabial folds, maybe explaining that that's really not the right treatment. And we also have to treat your cheeks and your temples first before we directly treat your nasolabial folds. Or, maybe we need to do your chin and your jawline and your preauricular area. So I would say try to really, even if it costs money, go for consultations and feel that out. And also use your intuition a little bit. And if it feels wrong and it feels pushy, leave, go somewhere else.
Yeah.
Yeah.
What's that process like for you, like trusting your intuition and kind of reading the signals from within?
So I've always been a really intuitive person. This is something that I thought was weird when I was little. But I always had really strong gut feelings. And whenever I didn't follow my gut, it would get me in trouble.
Yeah.
So as I've gotten older, I've just learned to trust myself a little bit more. And in trusting myself, I've found that I've become really successful.
Yeah.
So when I don't trust myself and I listen to the noise, it never works out for me. So I listen with discernment to the noise, but then I always end up going with how I feel.
Yeah.
If that makes sense.
Yeah. It totally makes sense. I just think that this is not something we're ever taught to do.
Mm-hmm.
And obviously trial and error is a huge factor in learning how to get really quiet and listen, but it's not something that comes natural to so many, and certainly did not come natural to me for 3.5 decades, I would say.
Fair.
So when you're saying that it's been something that you've been able to do and channel since you're little is so impressive and admirable. And if you were giving advice to someone who's looking to hone their intuition without that natural ability to read it, what would you say?
I think that, like I said, there's just a lot of noise. And I think that when something feels good to you, you need to kind of move in that direction. And it can be in any phase of life, whether it's staying in on a Saturday night and not going out and drinking just because your friends are, or wearing the outfit because when you look in the mirror, you think it's pretty no matter what the trend on Instagram is.
Yeah.
Or maybe, I don't know. I think you have to just really feel it out for yourself. Like I said, for me, it's always been just when I go with my gut, it's been good for me. And when I don't, it's not.
Yeah.
So I think you really just need to quiet everything else and maybe journal, write, or not journal, but jot down pros and cons. That's helped me in the past. When I really need to make big decisions and there's just a lot of pressure from the outside, writing down why I think this would be a good idea and why this would be a bad idea, that could help as well, just to kind of get you in that mindset and practicing, okay, how do I make decisions for myself based on how I'm feeling?
Yeah.
Yeah.
Yeah, I love that. That's such a good idea.
Yeah.
And in terms of choosing procedures, women who come to you, obviously it has to do with what their goals are, but green lighting and moving forward with a certain kind of injectable or a certain kind of laser, what do you think is behind that in terms of people making the right decisions for themselves?
So I think that there are a lot of factors. One of the biggest factors is, again, education and really understanding why we're doing this. So why are we injecting the temples and the cheeks over directly treating your nasolabial folds, even though you come in saying, I hate my nasolabial folds, make them go away?
Yeah. And
understanding your boundaries and your limitations when it comes to aesthetic treatments, understanding how to understand a plan, if that makes sense.
Yeah.
And understand that generally improvement doesn't happen in one session. It's usually over time. And it's this thing that's compounded the same as fitness or diets would be. So it's something that kind of grows and develops with you.
Yeah.
Yeah.
I love that too, that it's not just a quick fix and it's not transactional, like you said. It's not, I will see you next year and we're not going to really have this continued progressive build.
Right. So, I mean, I think it's also important if you're not here in the area to see me or someone else that you trust, find someone who's going to have thorough follow-up. So I see all of my patients after. If they can't come into the office, I'm FaceTiming them. I'm asking for photos. I want to see what's going on.
I know.
So, yeah. So I think that's a really, really big part of this whole thing.
Yeah.
And just seeing what you did and if it worked.
Yeah.
And that's also how you get better on the provider end. It's how you learn.
Mm-hmm.
So it's like, did what I do work for this person?
Yep.
What else do we need to do to help them get to where they want to be? Do they need anything else? Can we stop and put them on maintenance?
Yep.
So the follow-up is key.
Everything. I mean, I don't know if you remember, but when I got the CO2 laser with you, first of all, I had no idea what I was going into.
Yeah.
And I think it was better that way.
Yeah.
But I have a high pain tolerance, and it was fine. And the next morning, I expected to wake up a little bit red, like almost as if I had gotten microneedling.
Mm-hmm.
And when I woke up swollen and literally like the color of a stop sign at 5 a.m., in a panic, I texted you, and you responded so quickly saying, this is normal, and if you want to come in later, feel free. But it was not an abnormal reaction for my skin to do this. I just didn't know. But I just remember feeling so cared for, and every time you're like, I'm booking you for the follow-up, I want to see you, even if it's for 2 seconds, it does create this feeling of this not just being like a wham, bam, thank you, ma'am, I will see you whenever you come back for this time that you're going to pay me a sum of money. You know, it really does feel like you're cared for and you're considered. And I also remember something that you said to me one of the first times that we had a consult was, your face is a walking advertisement for my practice.
It's so true.
I just think that is something you do not hear a lot. And yeah, it's not necessary medical treatments we're getting. These are elective, but they matter. And to have a practitioner say that to you really makes you feel like you are in amazing hands.
Yeah, that is something that I actually tell a lot of my patients, because when they say, am I going to look puffy? Am I going to look crazy? I think there's a lot of misconception around injectables.
Yeah.
And you really are a walking advertisement. I mean, you see hundreds of people a day when you're teaching.
Yep.
And I'm sure there are times when people say, where do you get your Botox? Where do you get your filler? Who do you go to for your skin? If you look crazy and you say, I go to Sophie, they're going to be like, I am not going to Sophie. So I want people to come and ask you because they think you look beautiful and also make you feel beautiful.
Yeah.
So I think that understanding what you're doing and what you're putting out into the world really matters and is seen by so many other people.
Yeah.
And also, like, I want you to feel confident. Like, that's the whole point of this. Feeling crazy is never the point.
No. And it's funny, I actually literally had someone text me 2 days ago saying, where do you get your injectables? So you may have someone new coming.
Thank you. That's exciting. We love that.
Yeah. And I love that too.
Word of mouth is the best.
Yeah.
Yeah.
So obviously in this space, trends move like wildfire from whatever area, social media, influencers, people who see you in real life, and that word of mouth effect. How do you deal with patients who come in trying to chase trends who may not really have like the understanding of what goes into that? And how do you kind of steer them in a direction that is a little bit more in alignment with your style and views?
So I'm not trendy. Never have been, never will be. I'm like a tried and true girl. I really think that trendy is just not the way to go. We are in aesthetic medicine, emphasis on medicine.
Yes.
And people forget that. So when people come to me and they're like, I want this treatment under my eyes that this person got on Instagram because Alex Earl got it.
Yeah.
And she said it was amazing. I'm like, great. Well, I don't do that. Here's what I do. And I know that this works for what you're at, like for the problem that you're posing and what you're asking me to do. And here are before and afters of some of my patients that have gotten this treatment and we've successfully solved their problem.
Yeah.
So for me, I'm not a trend chaser. Like I said, I'm not trendy. I never will be. I do things that are tried and true. I let everyone else around me mess around, and I will never be the first.
Yeah.
I will always be the person that waits and sees and makes sure it's safe and make sure that the outcome is going to benefit the patient and make sure that there's longevity in the treatment that we're doing. And it's why I don't carry everything. And it's why I'm very selective about the products that are in my practice, because I really only carry things that work.
Yeah.
And I carry the things that are the gold standard for what we are treating. And I don't need to carry everything. When something's out of my scope of practice or I don't do something, I'm perfectly fine sending out. I send to plastics on a weekly basis.
Yeah.
I send to other injectors if I don't have a laser that needs to, accomplish something for a patient, or if I don't do a type of injectable that I know would benefit a patient. And to be honest, most people appreciate that and then they come back.
Mm-hmm.
So I think understanding, again, emphasis on medicine and that referring is your best friend.
Yeah.
And like any other doctor or nurse practitioner or PA would do in a primary care setting or any other specialty, when we can't do something, we refer out.
Yeah.
So it's like, yeah, there's trends all around us, but again, this is just noise. It goes back to just like following who you are. And I think that staying up to date and understanding what's in the field and what's out there is good, and that's a great thing, but not necessarily doing everything and kind of choosing your treatments with discernment.
Yeah.
Yeah, so I guide my treatments for my patients in a way that is really going to make sense for them. It's going to have longevity. We're talking about long-term skin health.
Yeah.
What our tissues are doing over time, how to actually like restructure and rebuild what we've lost. It's never going to be a trendy thing. It's always going to be like, let's work on the foundation.
Yeah.
Yeah.
That's amazing. And like I want to pivot to a little bit more of how you essentially handle and care for your own health as a woman.
Mm-hmm.
But from the perspective of a business owner and someone who has built something from the ground up, from scratch, how do you think that plays into your well-being overall?
Okay, so I think that when you don't fill your own cup, it's kind of like a cliche, but you really can't give to others. And what I do is really energetic, and I'm touching people's faces all day. I'm listening to their problems all day long. And I love what I do. I'm really passionate about it. But when you don't take care of yourself, it's really draining.
Mm-hmm.
And there have been moments, like when I first started my practice, where my health was not my priority. And as I've grown in this practice, that's shifted, because I've just noticed I can't give 100% if I'm not feeling 100%. So taking a little more time to go to acupuncture or go to yoga, or coming in an hour later so that I can go for walks, or leaving an hour earlier so that I can see the sunset with my dog. Like, those are things that have kind of shifted my health and not really affected my practice. It's actually made my practice better, because like the attention that I'm giving to my patients is more concentrated.
Yeah.
And I don't feel scattered or drained or all over the place. I feel like when I'm there, I can really focus on what I'm doing. And I'm not like, oh, I'm missing another day.
Yeah.
It's like that's not the point of owning a business. The point of owning a business is, eventually to have a really great life for yourself, and you're
Mm-hmm.
building something that doesn't exist elsewhere, which is why you're doing it, or at least why I'm doing it. So part of that is like kind of practicing what I preach. And if I'm not this like healthy, happy person, like how can I make my patients healthy and happy?
I love that. And for you, like, what are the pillars of health or the principles that you live by? And when it comes to like nutrition, fitness, those intangibles, like going to the beach and watching the sunset and being really present and intentional in your life?
Yeah, so I am not an extroverted person. I'm like somewhere in the middle where I can kind of like be really extroverted at work, but then like I really like to be alone.
Mm-hmm.
So that alone time is like so important for me. Like, I would rather sit home on a Saturday night than be at any bar ever, like with my
Same.
dog.
Mm-hmm.
Yeah. So I think just being true to myself and feeling my feelings and feeling how I'm feeling that day, like even if I have a workout planned, if I'm really not feeling well or not feeling up to it, I don't necessarily force myself to go, whereas a couple years ago I would have. And then you kind of feel worse. So I've learned to listen to my body, and if I need to sleep in a little bit, I sleep in. I think that working out a couple times a week and doing yoga has been pivotal for me. It's kind of taught me how to listen to my body. Acupuncture, that's a non-negotiable for me. I go once a week. And that has been life-changing.
Yeah.
Yeah. Diet is one of those things where I'm very sensitive to a lot of different foods. So for me, my husband and I cook a lot, and we're, both really, really healthy people. So we're eating 3-4 times a day and mostly like high protein, lots of veggies. I think that type of lifestyle, like, we really enjoy. Neither one of us are like junk food people. Every time we eat it, we feel like crap.
Yeah.
So these are things that have just like over time become just what my lifestyle is.
Yeah.
And those are almost, I guess, like the pillars of how I stay healthy. And I think also listening to your body over time I used to be really, really intense with my athletics, and I'm not so intense with my athletics anymore. I really listen to how I'm feeling in the gym. It's not just about pushing myself as hard as I possibly can. It's about like, okay, maybe today's a slower day and we're going to lift and it's going to be slower, and maybe tomorrow I'll feel like I can be at 100%, but today I was at 70, and that's okay.
Yeah, and it kind of draws upon that balance that you were talking about in naming Soluna.
Yeah.
I think that's obviously, that's a huge part of yoga, duality, and understanding that there cannot be light without darkness. And there's some moments when you have to push, and then there's moments where you want to pull back, or maybe there's days where that's just pushing is not on the menu for you, and you recognizing that. But I don't think that you can get to that place without consistency.
No, I agree with that. And I mean, for many years I was doing 2 a day.
Yeah.
2 a days at Yoga Joint, 6-7 days a week. I had an 8-pack. I was eating 1,500 calories a day of like straight protein and vegetables, never touched a carb. I was very strict with myself. I would wake up at 5 o'clock in the morning, 4 o'clock in the morning to study, and then go work out and do a double, and then go do a 12-hour shift at the hospital, or work and go to school all day long and come home and study and work after. So there's a lot of consistency that comes before the grace that you learn to give yourself.
Yeah.
And I think that the grace has been new for me, but I actually really like it, and it's something I plan to continue. But yeah, consistency is important. I mean, I always show up. I definitely still, I go to the gym or yoga. I do some sort of movement every day, whether it's walking, yoga, the gym, something, just to like move.
Yeah.
So that's really important for me. I feel like moving is one of those things where even if it's a 10, 15, 20-minute walk, it just changes your whole day.
Changes your whole day.
Yeah.
It's so interesting to me how many, when you kind of simplify and you go back to foundational principles in health, in many different aspects of your health, there's so many parallels, because what you were talking about in your practice, like, you see patients and you understand with patients that it might not be just like that one shot of Botox that you're doing that day, or the first time you're giving people fillers and you're never going to see them again. You build as you go.
Right.
And you're creating someone's essentially like dream aesthetic over time. But it's the same thing with all of like your health habits. Like, if you are disciplined in the gym and there's consistency and dedication, then over time you can lighten up as you understand the signals your body gives you.
Right.
And I just think that that's so interesting, and it's not talked about a lot. Like, we want everything right away, and we want everything in a way that it's going to be perfect always, but that's not the reality. And like, everything ebbs and flows. If someone gets a treatment with you, it's not going to look good 6, 8, 10 months later, because the effects are going to wear off, and then they need to like come to you again for something that's either going to be built on top of whatever you've done, or something that's completely new and different direction.
Yeah. And I think that is part of planning in aesthetics, and the part of education that's really important, so that your patients understand, okay, we can't just, erase 25 years of damage with 40 units of Botox.
Yeah.
It really does take time, and it's the same as everything else. And I do use that comparison in practice. I always say, these treatments are like going to the gym, or they are like going to yoga, and the more you do it, the better you're going to be. And it does take time. It's like, you're not going to be able to do a headstand on the first day. I mean, maybe some people can. I can't. But most people can't just like jump into yoga and do a headstand. It's just not really a thing. Like, that's something you learn over time. And it's the same thing with your face. It's like, you neglected your face for 25 years. Like, I can't fix it in one appointment. This is going to take a year. So understanding that, and having a provider that really understands how to explain that to you is really important
Yeah.
as well. But yeah, it's all the same. It really is all the same.
Yeah.
Yeah.
That's amazing. I just like drew that parallel right now.
Yeah.
When it comes to, like you said, giving yourself grace and the tendencies we all have that lean towards like pushing as hard as we can, as often as we can, because that is a real thing for women, especially like we want to be doing all the things all the time. How do you handle that in your personal life and your professional life?
So I was one of those people, like I said in the beginning, I'm a total overachiever and I'm always wanting to level up. I'm always wanting to do more, and how can I be better? And my brain never stops.
Yeah.
So, giving myself grace is a really hard concept. It took me a really long time to start doing that. But I got to a point where I was so burnt out from working out twice a day, working 24/7. I was sleeping like 3 hours a night for years.
Wow.
4 hours a night. Even on weekends, all I would do is sit, study all day. I stopped like kind of having fun and enjoying life. And I realized I sort of felt like I was like watching my life from another perspective. And I was really apathetic towards everything and life and just everything in general. But I wanted this like big, beautiful life. And I felt like it was kind of in the palm of my hands, but I couldn't like grasp it. So it took that burnout and it took me working so hard for so many years in every aspect of my life to kind of like have the six pack and, be this perfect version that I had in my head of myself and have the straight A's and have the practice to realize like, okay, we've gotten here. Now what? Like, how do we make this sustainable? Because this is not sustainable. And I would like literally wake up. My cortisol was so high. I was waking up every morning at like 3:00 in the morning. Like I would go to sleep at 12, wake up at 3, and then I was up.
Yeah.
So I would just study, or I would just like make coffee and go to the gym or go for a walk. Like I would just keep moving with my life. So obviously that's not healthy, and obviously something had to change. So as getting kind of like back to your question, like giving yourself grace is something that allows you to be successful in a sustainable way where you can continue to build over time. And I think that it takes a lot to get there for most people because you really do have to have that drive and consistency and kind of be like relentless to get. I mean, I wouldn't have gotten where I am if I didn't have that phase of being relentless. But now that I am kind of sort of where I want to be, we've moved to a point where if I take a break, it doesn't feel like the world is ending.
Yeah.
So I think that that's important to kind of grasp, is just taking breaks is okay. And it almost gives you like more inspiration and allows you to like be more creative and be happy. And, if you need to take a day off, like take a day off. The work's going to be there when you get back. And that was something that I was like, I have to get everything done right now. But it's still going to be there when you get back from your couple of hours of a break. So it's okay to take that time for yourself. And it actually like you're better for it most of the time. Obviously, don't get lazy. But I think like falling into patterns of laziness and, it'll be there later is not great either. I think you have to find a happy medium of like, okay, we took the time to relax. Now let's get back to work.
Yeah.
Yeah.
I couldn't agree more. And then like when it comes to that concept of discernment in your own life and in your business, because you're making a lot of decisions day to day, how do you exercise that and how do you trust yourself to choose the right things for you?
I think that goes back to intuition. And I am constantly educating myself. I consider myself to be like a forever student. I really like live by the saying, you don't know what you don't know. And I never think that I know it all. So I'm constantly training. I'm constantly listening to other people's experiences about their businesses and how they built things. When I don't know something, I get a coach. So I have a personal trainer. I have an accountant. I have a therapist. I have an acupuncturist. I have like all these people in different areas of my life to sort of coach me through things that I'm not an expert on.
Yeah.
And you can't be an expert in everything. So I know what I know, and then I'm learning along the way. So I think those decisions come from where my education is at the time I'm making the decision, and also what I believe to be the best thing for whatever problem I'm trying to solve or whatever outcome I'm trying to achieve.
Yeah. And I think that's something that is kind of like not in mainstream discourse enough is like a lot of very, very high level people have coaches. Like there's no limit to how senior or educated or magnanimous you might be. We all need those experts that we trust to hold us accountable, to take us to the next level. I kind of live my life in the same way. Like I have a fitness coach, an acupuncturist, and I'm pretty sure we go to the same place. And there's people, you know, from a business context who I really consider to be mentors. At Yoga Joint, there's a lot of like education that goes on in terms of coaching and ascending, always refining. And understanding that it's like not shameful. It doesn't say anything about you being weak or incapable to have that assistance and to really be guided in that way by people who you can outsource the expertise of those areas of your life to.
Right. I mean, it's not like we're born with this like innate knowledge of business or like how to run a practice or how to practice medicine or like how to be a yoga teacher. Like that's not just in you.
No.
I think that people are guided by, you know, what people are drawn to things and it kind of like guides them through what their path is supposed to be. But I think, like you said, having mentors and just really honing in on continuously learning, that's how you become great. And that's how you become this person who can build and grow constantly. It's sort of separates you from the people that are just like, I'm doing what I'm doing and that's it.
Yeah.
It's like, no, this is part of like leveling up and continuing to grow and get better.
Yeah.
And you can't do that just by doing what you're doing.
No, and I think it's a balance to what you said earlier between humility and that lack of a cap. Like you seeing that there is no cap on how high you can go, but being humble enough to know that you need the help in certain areas to take it to the next level.
Right. And no one should ever be ashamed of asking for help.
No.
I think that you're right. It's like become this weird like taboo thing to say like, oh, I don't know it all.
Yeah.
Like I am the first one to say, I don't know, go here. I don't know, here's a referral. And I think that it makes me better because then I ask the person who I send them to, or I ask my mentor, or I go to whoever I believe can actually answer this question. And a lot of times I learn from what I don't know. And then the next person asks me, I do know.
Yeah.
So you're better for it long term.
Yeah, and it's this paradox between being in the world where we have access to so much information, more than ever before, but we only know what we know. And it is really easy to fall into like a shame spiral of thinking that not knowing is something that you should hide, as opposed to, like you said, being very, very vocal about the fact like you don't know everything. And it reinforces the trust that your patients have with you because they know you're not going to take anything on that you are not confident in.
Right. Yeah. I mean, people ask me for nose filler all the time, and I'm like, nope, I don't do that. Go here. Yeah. So I'm like, I will never do that. So yeah, it's just that's like a silly example of one of the things that I refer out for on like almost a weekly basis. So yeah, it's just I don't feel comfortable doing that. I'm not educated on how to do. I mean, I am, but not educated to my standards on how to do it, and I just don't think it's something I'll ever bring into my practice.
Yeah.
Yeah.
And two-part question. What have you personally had done in that world, like in the aesthetics world? And then what do you kind of see on the horizon, like all the technology that's going to be coming in like, 3 to 5 years?
Okay. So starting from the beginning, I've had all types of filler. So I've done my lips, I've done my cheeks, chin shadow, temples, jawline. I mean, I've had filler everywhere throughout the years, different types of filler. I've done Sculptra, which is a biostimulator. I've done PRP, PRF, microneedling. I've done clear and brilliant laser. I've done the cool peel, which is a CO2 laser I have at my office. I've done VI chemical peels. I've done face reality chemical peels. I've done Morpheus. Hated it. That one wasn't for me. I've done IPL, which is like a vascular laser. I've done Radius, which is like another type of biostimulator. Yeah, I basically have tried it all. I'm not scared of aesthetics. Again, I'm not scared of talking about it.
Yeah.
These are all things that over time have been things that have helped me when I wanted to address issues. And when I get these things done, I do have a provider that I've been going to for years that I trust implicitly. I mean, literally walk into her office the same as how you feel with me. I'm just like, I don't even tell her. I'm just like, assess my face and do whatever you think needs to be done. And I will pay the bill at the end.
Mm-hmm.
And that's it. Because she is looking at my face and knows a little bit better than what my perception is.
Yeah.
So obviously if I have a concern, I tell her, but generally she hits the nail on the head with it.
Mm-hmm.
So I think that that's a really good way to walk into a practice, is to just say, like, what do you think?
Yeah.
To a provider, and like, what's your assessment of me, and like, how are we going to make this happen?
Mm-hmm.
So over time, she said, hey, I think sculpture would be great for you. Hey, I think you need a little bit of temple. Have you thought about your cheeks? I think we need to do a little bit of chin. And, you know, this is all happening over the course of like 10 years. So as I've aged, we've done treatments to accommodate that. And yeah, it's been great for me. I also have had Botox, but Botox unfortunately doesn't work on me anymore. So now I do everything in my power to keep everything tight and pretty.
And in that case, like if Botox doesn't work on you, what are the alternatives?
Sculpture, same things like you talked about. That's why I do everything also, because sculpture helps with, you know, the skin quality and almost the skin thickness, the filler for volume loss. Nothing's going to replace Botox, but you can get a really beautiful, smooth result from doing a combination of other treatments. Stuff working on skin quality, microneedling, lasers, like I said, chemical peels, all of those things are going to help. And yeah, over time, eventually I'll have a brow lift or whatever surgical procedure is in my future that I think will help, because I can't do that with Botox. But yeah, when that time comes, I'll be happy to talk about that too. Yeah.
We'll have you back on.
Yeah.
And what do you see on the horizon for technology in this area?
So I think there's a lot of, right now the industry is kind of on fire. There's a lot of experimentation with peptides. There's a lot of experimentation with PDGF, which is platelet-derived growth factors. That's being used in other fields of medicine like orthopedics successfully. In aesthetics, we're seeing a mix of really great results and really a lot of complications. I do think peptides are something that are going to be really, really big moving forward. They're already big, but I think they're going to play an even bigger role. And I also think that we're shifting from a lot of filler, an overdone filler, to really natural aesthetic, which I love. It's becoming one of those things where everyone wanted to look like Kim Kardashian, and now everyone sort of wants to pull it back and look like themselves. Yeah. So I think regenerative medicine is on the forefront of what's happening right now, and that's something that I've been doing from day one. I started, before I was doing filler and Botox, I started doing PRP. Yeah. So stuff like sculpture, radius, laser treatments, PRP, PRF, and like I said, peptides, those are going to be, I think, the big players in the next couple of years, and it's already starting to happen. Yeah.
And you have the glass skin facial.
Yeah, exactly. We love the glass skin facial.
What's in it again?
So I have actually 2 versions of it now. Oh. So we have one that is a combination of microneedling and a light CO2. And then we have another one that is a combination of a light CO2 with a chemical peel.
Oh, wow.
So both accomplishing similar but different things. And one is the microneedling, and the CO2 combo is more for collagen stacking. The CO2 with the chemical peel are more for our melasma hyperpigmented patients that are looking for just like a super glassy, smooth look. Wow. So yeah, I love those 2. Yeah. They're big. Those are big players at my practice.
Yeah.
Yeah.
They're amazing.
Thank you. I love them.
So to wrap up, like if you were to give the listener a mantra or kind of like a principle that you live your own life by, personally and professional, what would it be?
I think you really just need to follow your gut and be true to yourself.
Yeah.
So like I said, a lot of my success has been based on being true to myself and just following my intuition and really tuning out the noise. So I think just tune out the noise, and if you want to do something, you go for it, and you go for it 100%. So
I love that so much. And so where can people find you?
So I am I'm in Glades, right off Glades, between St. Andrews and Glades.
In Boca.
In Boca Raton. Sorry, I just stuttered when you asked me. Yeah, so I'm right between St. Andrews and Glades in Boca Raton, or right across from Town Center Mall.
Mhm.
And our practice is called Soluna Aesthetics. And yeah.
And the
where you can find
Instagram
us.
handle is?
Instagram handle is at Soluna Aesthetics.
And your personal one?
My personal one is Dr. Sophie Lanter.
Okay.
Yeah.
Amazing. Well, thank you so much for coming on. It was such a pleasure, so much fun.
Thank you for having me. I loved it.
Oh, thank you.